Okay. So thank you so much, everyone, for coming. It's really a pleasure to be able to see people in person, particularly those of us who don't have COVID. I know there's been a big wave going through campus. But it's a huge pleasure to welcome Dr. Renzo Guinto today and have him here in person all the way from the Philippines. Renzo studied at Harvard and is now the new director, is it, of the Sunway Center for Planetary Health?
Correct.
As well as still affiliated with St. Luke's Medical Center, and is sort of spearheading planetary health in the Philippines, and very well connected and well respected globally as well. I feel like there's constant talk, so we're very lucky to have him with us here today, and is a key collaborator for Climate Cares, our program in climate change and mental health. So I'll let you take it away, Renzo. Thank you very much.
Thank you so much, Emma. Thank you so much, Climate Cares. Thank you so much to Imperial College London's Institute of Global Health Innovation. It's great to be giving a lecture again in person after 2 years. Not anymore sitting on my desk looking at Zoom. Instead, having a human-to-human interaction, contact, which is very good also for mental health, because that's the main mission of Climate Cares. So what you didn't mention is that I'm part of the Climate Cares family as part of the advisory board, and so I'm really, really elated even to especially meet Emma in person. We've been collaborating for more than a year already, and now you are able to confirm that Renzo is a real person. And for the next several minutes, I'll be bringing you to the Philippines to share some insights, perspectives, experiences when it comes to the nexus of climate change and mental health. Just a caveat, I'm not a trained psychologist. I'm also not a trained psychiatrist, although when I was training in medicine as a physician, psychiatry certainly crossed my mind. Maybe it's something that I can pursue as a clinical specialism moving forward. But instead, my work in medicine, public health, health in general, brought me to the world of climate change, the world, unfortunately, of a warming planet. And that is what I've been working on for more than a decade now. That's the area of, specialty that I focus on, the intersection between climate change and health in general. How can we build health systems that, can address the myriad challenges related to the climate crisis? But then it actually brought me to the mental health space. And I guess that's what brings me to this talk, perspectives from the Climate Frontlines in the Philippines. And, I want to start by not just acknowledging the times where we are in right now, right? We're still in the middle of the pandemic. I was hearing a while ago, sadly, some colleagues couldn't be in person because of the, COVID surge that is starting as more people are now going out. This weekend, there's an Adele concert, I heard. And for sure, a lot of people have been concentrated in one location. Hopefully that will not lead to another outbreak. Back at home in the Philippines, the numbers are also rising. So certainly there are, concerns about future, perhaps Omicron-like surges that might happen in the coming weeks and months. But I think and I believe that we should be equally, if not more, concerned and afraid of not just waves, but tsunamis, as you can see in this caricature, of climate change, biodiversity collapse, and all their, countless, health impacts. And that's why, yes, we need to continuously address this ongoing pandemic, but we cannot, lose sight of what is yet to come and what is already happening, as you will see later, in terms of the health impacts of climate change and planetary health challenges overall. And that's why, a while ago I mentioned that, from medicine eventually went to climate, and then now to mental health, just showing how things are really, at the end of the day, deeply interconnected. And while my training is in public health, I early on, discovered, found out, realized, there was sort of an epiphany that we cannot just be taking good care of our people living on a sick planet. And that's why I early on embraced this shift, perhaps even an expansion from a public health approach looking at just the health of people, but instead moving towards a broader planetary health approach that brings together the health of people and the health of the planet. And as a physician, the way I usually summarize it to my patients, to the communities that I serve, the colleagues, I now have two patients in the 21st century, in the era of the Anthropocene. You might have heard of that term, this era or this epoch where humanity is now the biggest force shaping the face of the earth, not anymore a natural phenomenon unlike, in the historic past, right? We were just talking about the Natural History Museum a while ago, and for sure you'll hear about the dinosaurs and those past epochs where something natural, quote unquote, happened. This time it's us humanizing and even homogenizing our natural planet. So the way I see it is I have two patients. You have this kid wearing a face mask, trying to protect herself from the unseen coronavirus. And on the other hand, you also have Mother Earth, also wearing a face mask, of course not to be protected from SARS-CoV-2, but from the myriad ecological damages, anthropogenic changes that we are inflicting on her. And, in connection to, the planetary health concept, I think central to it is this idea that what we do to the earth, they just come back to us in the form of human disease, despair, if not death. And I added despair there because it's not really just about the physical health impacts that we should be concerned about when we talk about planetary health, but also the mental and emotional health impacts. And that's why, I'm very proud to be part of the Climate Cares family, and I am rooting for our community to really advance not just the science, but the societal change that is required to improve mental health on a planetary scale. And I think planetary health is also an opportunity for us to recast our broken relationship with the Earth, with the planet. It's calling us to shift away from an ego-logical perspective or approach. Oh, we are at the top of the pyramid of nature. We can consume, mine, extract, kill. We own Mother Earth. And instead, it invites us, planetary health invites us to shift towards a truly ecological approach where we live in harmony, in greater solidarity, in interdependence with Mother Earth, with all the creatures great and small that inhabit it. So, and I think that this is something that can also be useful in our campaign in climate and mental health. It's all about healing broken relationships with each other, but also between us and Mother Earth. So I told you I'll bring you to the Philippines. Sadly, the actual visit might need to wait for a bit because of, again, these surges that are happening. But also, we need to devise a way so you can come there in the future in the most, well, not really least carbon way, but the most carbon efficient way, right? So maybe when we bring you to the Philippines or Southeast Asia, we'll be doing 10 activities, just within one visit, similar to what I've been doing for the past 3 weeks here in the UK, learning about Tudor history while giving a talk at Imperial, attending a conference at Oxford. So really maximizing the carbon that I emitted by flying all the way from Manila to this part of the world. But for now, enjoy the beautiful sights of the Philippines. Okay? And now I'm reminded, we always talk about nature-based solutions, not just to physical, but also to mental health. I think this is the reason why we need to protect all of these natural ecosystems. It's good for the health of the planet. It's good for the health of our economies. We'll be able to produce food for people. But also it's good for our physical and mental health as well, to be living in these kinds of environments. That's the chocolate hills. Because they look like Hershey's chocolates when it's summer. They turn brown. This is the rice terraces that were built by indigenous populations from tens of thousands of years ago until today, providing food, rice in particular, to Filipinos. And of course, our beaches, we have 7,000 plus islands. And so, when you visit the Philippines, we can pick one and stay there for an entire week and have, a workshop. Indeed, a very good place to be. And, in the Philippines, you already mentioned, Emma, a while ago that, in a way, I'm kind of, leading the planetary health movement there as well in Southeast Asia. Planetary health, because of the complexity of the challenges that I just presented to you a while ago, it requires a truly transdisciplinary and a cross-sectoral approach. And so what we did during the pandemic, via Zoom, we created, communities of people from different backgrounds, interprofessional, interdisciplinary, intergenerational even. We are welcoming both the young and the young at heart to be part of the planetary health movement. So if you're interested, visit planetaryhealth.ph and you will see our activities as well as the voices and faces of planetary health in our part of the world. So the Philippines is, as I've said, 7,000 islands located in Southeast Asia. This is the map of our region. On top of Southeast Asia, you'll find China. And then on your right side, you will see the Pacific Ocean. Southeast Asia is a climate hotspot. It's a tropical region where a lot of these lush ecosystems still exist and thrive. In this map, you will see that the redder the country is, the more vulnerable the country is to the climate crisis. And unfortunately, my beloved country is the reddest of them all. So it just shows to you the heightened vulnerability of the country to climate change and its myriad anticipated impacts. Okay? And so, when these extreme weather events, typhoons, intense flooding do happen, do strike, entire communities get destroyed. I'm sure you've seen over the past several years in the news, the Philippines is hit again by another super typhoon, destroying farmlands and school buildings and displacing communities, destroying hospitals even. Health workers themselves become victims as well. And so this is really a reality that has already been happening in the country. These typhoons, extreme weather events now increasing more in severity and frequency. And over the past 2 years, during this pandemic, we've seen the confluence between the climate crisis on one hand and the COVID crisis on the other. So imagine you're a poor Filipino living, in a rural area, perhaps near the coastlines or along the coastlines, and you're living through or along the corridor of the typhoon coming from the Pacific. You were faced by a real dilemma. On one hand, do I stay in the house to protect myself from COVID? But perhaps my house will get inundated by intense flooding, or the roof of the house might be blown away by the strong wind. On the other hand, do I move to these cramped evacuation centers? As you can see, there's no social distancing to begin with. And so while you may be safe from climate-related disasters, there's a very high chance that you will be contracting SARS-CoV-2 in these kinds of, poor living conditions. So, and of course, what is also not being said is that whether you stay in the house facing the typhoon, or you move to these evacuation centers where you might get, the COVID-19, the mental stress is similar, existing in both settings. Okay? And that is, I think, the hidden impact that, even media is not capturing. We always think, you'll either get cholera here or COVID there, but not the emotional and mental stress that these situations do bring. And of course, another type of impact that the Philippines is experiencing is sea level rise. So, for those who are from the climate space, environment space, we know climate change is going to affect our societies either through the abrupt extreme events like typhoons, hurricanes, cyclones, or the more slow onset effects, for instance, sea level rise. And unfortunately, the country, as I mentioned, 7,000 islands, so a lot of these islands are low-lying, facing the ocean. The country is already experiencing the fastest rate of sea level rise in the world, around 5 times that of the global average. So you go to these poor communities, fishing communities, and they will tell you that the ocean is already swallowing, their islands. They're being swallowed by the sea. And indeed, not only our small islands will be swallowed, but also our capital city is at risk of extreme inundation within the next 20 to 30 years if climate change will not be averted. Manila is one of the densest cities in the world, around having around up to 20 million people during the daytime when people come from the provinces to the city for work. And so this is going to also perhaps drive what we call climate-induced migration. Internally, as in the case in the Philippines, but also if you go to Pacific Islands, they will need to be relocated to new places. I think some islands are already having conversations with Australia, right, to purchase, some land. And, this act of migration is certainly bad for physical health, for our health systems, but also for mental and emotional health as well. And this may be another specific research agenda in the climate and mental health nexus. How are we going to protect the mental and physical health of people on the move because of the climate crisis? So that's a glimpse of the Philippine situation. And, what I'm going to do, I'll pause for a bit because I want to also show a short film about one island in the Philippines that is already experiencing climate change and its diverse health and social impacts. This film is part of my doctoral dissertation at Harvard. My dissertation is actually half written and half in film. And the written part has only been read by, until now, 3 people. That's my doctoral committee, because it's long, and I still haven't converted it into publishable versions because of COVID. So many things need to be done urgently first. But my films have been seen by, I guess, tens of thousands of people around the world already. The last thing that I was doing before the pandemic was, again, going around Europe and in the UK to show the films to educate people about climate and health, especially in the Philippine context. So, again, instead of giving more slides to you about the Philippines situation, I'll bring you to the Philippines through this short film. Let me show it first.
ang pagkakaunawa kasi sa climate change,
your regular climate behavior that you are anticipating na biglang magbago. Kami, naranasan talaga namin yung impacts rin of climate change, which includes the sea level rise, may coral bleaching,
Dahil ito ay coastal
may
areas,
drought.
Dahil ito ay coastal areas, alam ba nila nagtaas yung level ng dagat. Kung uulan, mas matindi yung precipitation. Kung mag-init, mas prolonged period of drought.
May mga corals daw na siguro sa increase ng sa temperature yun, masisira.
Dahil sa sea level rise, yung mga bahay nila ay abot na yung mga sahig nila.
Dati, kung ganito lang yung kadami ng typhoon, iba na, mas madami na.
We were supposedly the first to be hit. We knew the mangroves will protect us. Kung bumagsak yun dito, sabi sa amin, based on simulation, 60% of us
the problem will occur today. The problem will occur today as of this day. Kasi marami pa rin nag-iulan. Hindi. Kasi marami kasi manpower. Ang pinaka-talagang manpower, wala din kami ECG. Wala din kami pala kami CT scan. Wala din kami Excel. As a doctor, ang malaking epekto ng climate change sa kalusugan ng mga tao.
Yung pat, yung dengue.
Hindi ka
At saka yung
nakasanayan yun
amoeba.
Hindi ka nakasanayan yun sa mga tao na iniinom. So kung yun ang iinumin nila, mag-iba yung stomach nila.
Ayaw ang gumagawa. Tapos ang epekto, ayaw din ang nag-harvest. Ayaw ang gumagawa talaga.
If your island community will become more inaccessible, how will you design a health system in that area? So what we did, accept na kada isang barangay, our communities, they have different health needs. And because they have different health needs, iba-iba yung approach mo.
Si healthy yung magko-complement. Si healthy yung magko-complement kung paano maging malusog yung mga pamayanan pagdating ng climate change.
Your local health system has to really be climate adaptive. It has to be because changing climate will have new health challenges. And every new health challenge require a new system, a new solution to resolve it. So it's evolving.
Pag sabihin natin climate smart, hindi siya madadaan kung gaano kaya madadaan kundi ito ay madadaan kung paano ba makakope up si community sa mga impact ng climate change.
We thought initially it's all about infrastructures and systems. We realized it all boils down to basic values. How do we now translate values to become part of your system and structures?
Mas better na mag-expend tayo ng millions of money per preparation.
All of our multi-purpose centers can withstand up to typhoon signal number 4. To protect landslide, sisimento mo talaga yung road. So it becomes access to health. And it's climate mitigation as well.
Ang food security, kahit walang dumating na mga goods galing sa ibang probinsya, kaya namin mabuhay.
We're also building one of the first climate field schools for farmers and fishermen. Is to capacitate the farmer and the fisherman how to do it right. If your climate is like this, your communities, they know more than you do. Then your role becomes a facilitator. Allow them to develop a system that allows adaptation, innovation all the time. Kasi nagbabago yung sakit, depende sa klima.
Yung indigenous at science, pagsabayin mo dun, andun yung masasabi mong innovation.
How do you make the right decisions? Babalik at babalik sa science. Kaya, yun din isang ina-advocate namin, science-based governance. We now have data to make better and more informed decisions of how to change and adapt to reach our targets, our vision. The problem is, it changes all the time. We live in a world of uncertainty na eh. The only certain is that you have the capacity to address the uncertainty. The local government is at the forefront of climate change. The national government is so far away. If the drought happens next season, we simply go to the local government. That's the structure of our society.
Pag healthy yung environment mo, natural na healthy din yung mga tao. Pag ang mangrove management mo ay maayos, Pag merong bagyo, merong sponsors, yung mga tao ay maayos sila.
Their climate adaptability started from us understanding kung ano yung vulnerabilities namin to now preparing survival to now having quality of life. Just preparing for the future. Climate change was never a threat to us. Kesa katakutan mo siya, that's why it's an opportunity to do something better. That's why it's an opportunity to do something better.
So I hope the short film was able to capture, some of the, not just the challenges, not just the threats that are already being experienced in the Philippines by local communities, but also some of the actions that they're already undertaking, and also the discourses, right? From climate change not being an enemy but an ally, all the way to the importance of, bringing together innovation, science, and indigenous knowledge, which they called innovation. And when I've seen this film maybe hundreds of times, right? And every time I watch it from the audience's perspective, it gives me some insights. And when I heard the phrase "climate field school for farmers and fisher folks," just came to my mind. What if we can build a global school for climate and mental health, right? To really prepare and enhance the mental and emotional resilience of people, right? Are from around the world in the era of a changing climate. Some initial ideas for climate cares. So now I'm shifting gears, and we're going to talk, or I'm going to share more specifically about climate change and mental health. Of course, we already know that climate change is already impacting our health. There's so many different pathways that link climate change and health. And as you can see on your right, there's really no single disease group that is immune to the impacts of climate change. Non-communicable diseases, perhaps, for example, because of exposure to extreme heat or air pollution, infectious diseases. There's a very recent study from Georgetown that that climate change is going to increase the likelihood of another zoonotic spillover. So more COVID-19s in the future if we do not get our acts together. Nutritional gains will be reversed if climate change will not be averted. And of course, mental illness or mental stress. And of course, to the climate cares team, this is a very familiar slide thanks to the hard work of Emma and team. And I love including this, very easy to understand diagram in my presentations, just to highlight that one, climate change is a mental health issue. Number two, climate change affects mental health in various ways. From the direct and abrupt events like typhoons, all the way to just being aware that climate change is happening is already creating some form of negative emotions or distress. And I will not elaborate because you have the expert here in the room. But, in the Philippines, for, I guess, maybe a decade or so, the conversations around climate change and mental health has focused more on the post-traumatic stress, sequelae that happens after, let's say, a huge calamity. This photo was taken in 2013 when the Philippines was hit by Typhoon Haiyan, still until today the strongest typhoon to ever hit land in human history. And you can see here, this was a day after the typhoon. An entire region was, decimated. But after that, the people, they were, looking for their religious, items, the cross, Jesus Christ, and they started this ceremony, this parade, of thanksgiving and prayer, that they were able to survive. Of course, more than 7,000 people were killed, during this calamity, and hundreds of thousands were affected and displaced. So this just shows to you, I guess the complexity of what happens to people's mental and emotional health after a typhoon. sure, it's sad, it's, distressing, but you can see also that, they've found ways to cope through prayer. Religion plays a very critical role in Philippine society as well. Later on, we can also discuss that. But in recent years, and thanks to also the work of, Climate Cares and other colleagues from around the world, there's growing interest in, the mental health impacts not of extreme events, but by the slow onset nature of climate change. So these are some of the articles. I'll not go into the details. And in the Philippines, there's also emerging interest in this area. And I actually want to acknowledge, one collaborator, John Aruta, and the two of us have been really, bringing our, brains together to come up with a better understanding of climate anxiety or eco-anxiety in the Philippine and Southeast Asian context. So there were some initial studies, of some cross-sectional studies that have been conducted, and there are already some signals that climate anxiety is already experienced, for example, in this part of the world. And perhaps, much more familiar to the Climate Cares group, this recent study published last year in the Lancet Planetary Health, they did a survey of young people from 10 countries in the world, and what they found out is that the young Filipino people, young adults, are the most climate anxious in the world. 74% said it's already impacting on their functioning, and around, close to 90%, at least moderately to extremely worried about the climate crisis. And, John and I have been thinking, so what might be the explanation for this? And so, we came up with this initial, think piece about potential explanations and pathways. And we think that one, young people in the Philippines, and you've already seen this a while ago, are already directly experiencing climate change through the extreme events. Second, there's also a direct and indirect experience of the slow onset events. You go to, communities in the coastlines, for example, and yes, they might not be hit by a typhoon, but they've seen their house already being slowly, again, as I've said a while ago, swallowed by the sea, their farmlands already experiencing, high salinization due to sea level rise. So those are some of the direct experiences of slow onset events that are creating certain kinds of, distress. Third is education and awareness about climate change. So, you might think that, the more educated the people are, the more empowered they'll feel to act on the climate. But our hypothesis is that maybe our education or the content in our climate education in the Philippines is actually paralyzing young people more than empowering them to act on the climate. So that's actually one specific research that we want to do in the future, to actually review curriculum, because climate education is already mandated in our Climate Change Act of 2009. So it's in the law. But what we want to make sure is that climate education, encourages action and hope rather than creates more fear. And again, as I've said, has a paralyzing effect. We can't do anything about the climate. We're a defeatist mentality in a way. And then finally, awareness of insufficient global and local climate action. So while, for example, the Philippines at the domestic level has been, very explicit in terms of, addressing climate change, especially from the adaptation perspective, because we emit less than 0.5% of the global emissions, so it's negligible. But in terms of adaptation needs, that's where, more investments are needed for sure. But, while the policies are there, action is still very slow at national and local levels. So, and young people are already seeing it. You might have heard that, when was that? June 30, we just had our new president. And our new president, who was a son of a former dictator, never mentioned climate change in any of his, public appearances. Well, he never attended a debate even, a presidential debate. So we know very little about what the new government is actually thinking around climate action. And that is creating worries for sure among young people. But, I still have hope because right now, young people, and of course, this might be a small segment of the youth population in the Philippines. We're a very young population. I think, there's hope because there are some young, groups that are mobilizing to turn their anxiety into agency. And this, I think, should be the aim of climate education. That's why a while ago I said we plan to investigate into that. But overall, there's still a very high possibility, and I think that's something we can think about on a global scale. How can we turn the global climate anxiety that we're feeling into a sense of agency that will eventually stir urgent action? So from anxiety to agency to action before 2030. That's the deadline, because beyond that, we're doomed in a way because we'll be not meeting the Paris Agreement goals. And then, as I already touched upon a while ago, we just finished an elections. And it's important that when we look at climate anxiety, for example, in the context of the Philippines, I'm not sure if this is something that will also resonate, for example, to the British young people. I know you've done a cross-sectional survey already here. Young people are experiencing anxiety coming from different sources. Climate change is one. The knowledge of it, the experience of it, post-election anxiety is now very high. And you can see that, especially on Twitter, as young people have exchanges about the future. I know a lot of people now looking at embassies of other countries. They want to migrate. And the Philippines is a country of migration. And now we're, kind of anticipating more outward migration, especially of the educated population, because of dissatisfaction domestically, while they see better opportunities outside. Social media is also creating its own kind of anxiety, and I think that's pretty well studied, especially in other contexts. And of course, COVID-19 is, again, still far from over, unfortunately, and it has created a certain type of anxiety and emotional distress on its own. So, maybe this is not anymore true. This was from like a few years back, when they hold these global surveys. Who are the happiest people on earth? We're always, number 1 to number 5, right? We're like competing against India and maybe some Scandinavian countries, right? But now I think, the situation has dramatically changed because of the sources of anxiety that I mentioned to you a while ago. And we really need to, advance this agenda, especially domestically in the Philippines, but in collaboration or in connection with the global agenda that we're developing here in Climate Cares. Okay? And so we created an agenda. This was published in the Lancet Planetary Health last year. We identified some, urgent actions and areas to prioritize, and I will be discussing them shortly in the upcoming slides. Okay? It's important to investigate whether our mental health system, if that even exists in the country, is ready to address, the emerging challenges, mental and emotional health challenges of the young people. I think the answer to that question is no, because this is the situation. Only 3 to 5% of our health budget, okay, is spent on mental health, and 70% of that is spent on hospital care. For example, we have the mental hospital in Metro Manila, overcrowded and underfunded, but already a bulk of the mental health budget, the limited mental health budget of the country, is going to hospital care. So more resources overall will be needed to address this emerging crisis. There's also a short supply of mental health workers in the Philippines, around 2 to 3 workers per 100,000 population. I think way below than what WHO has set. I think it's around 10. Can't remember. But then we have a new Mental Health Act, which was passed in 2019, with a very ambitious plan to not just invest in cure, but also in prevention, with strong emphasis on community-based mental health services. But COVID-19 derailed the plans, right? Derailed progress. And so this is the reality where we are in right now. Resources are limited, health workforce is very scant, and we're still grappling with the pandemic, and the ambition remains. And so, and climate change is making it much more complex. So, every time I talk to health professionals in the Philippines, I always say that, our healthcare system, now in a state of shock, it's certainly not ready for a pandemic, as we've seen, and most likely not ready for climate change. The same thing can be said, not just about healthcare in general, but our mental health system in particular, also in a state of shock, not ready for pandemics or climate change. So the question is, are we ready to build health systems that consider the climate? And that also includes, are we ready to build mental health systems that consider the climate? And there are already some frameworks, for example, offered by the likes of the WHO, how to build climate-resilient health systems. My critique, and our colleagues and friends in WHO are aware of this critique, is that one, as you can see here, the people are not included, right? We need to make health financing climate resilient. We need to make our health workforce, our doctors and nurses, climate equipped, or our health information systems linked to climate information systems, or our service delivery systems to be the last, system standing when climate-related disasters strike. But there's no mention of the role of people and communities, which is very important for building, climate, mental health resilience, or mental health resilience in the climate era. So that may be our contribution to highlight the missing, perhaps the centerpiece of this diagram, people and communities as sources of resilience. Okay? So this is another diagram from that report. It's very health system centric, or healthcare system in particular, or maybe you can even be more precise, disease care system centric, right? And totally ignores the role of communities and people in building our resilience to the changing climate. And that's why I think we need to adopt a more multi-level resilience perspective, right? Individuals and households, they are the first responders in a way. We've said that for COVID, and unfortunately governments have not listened. They have still adopted more top-down, militaristic, clinical measures and ignored the capacity of communities to address the challenges brought about by the pandemic. We should not repeat the same mistake when we try, or when we attempt to build resilience to the climate crisis, looking at individuals, households, and communities, the health system, and all the other systems where our communities, operate. We also need the colonial approach to this. Our climate cares friends, every time we have a meeting, they kind of already expect that Renzo will be the one to raise that there's always, the need for, context and culture, they matter. Okay? It's not about dismantling but enriching Western contributions. Otherwise, I'll not be an imperial right now, right? I think there's so much that we can come up with if we bring together all the, sources of knowledge that we have. And we definitely acknowledge what, for example, Western or Eurocentric science have done for our understanding of human psychology and society. But now I think it's high time to also bring, perspectives, for example, from Asia, right? And that's what we've been trying to do. What can, Asian understanding of psychology and the climate, can bring and contribute to the global conversation. We need to start looking at the global South, and I'm putting parenthesis, right? Sorry? Quotation marks here, because I think we also need to start questioning the terms that we use, right? Because, what we say is also a reflection of what we have in our head, right? And when we talk about global, the mental health and well-being of people, language is definitely very much connected. So the global South, non-Western cultures, I was tempted to even write, for example, Eastern cultures, because you're the non-Eastern culture, right? So it really depends on, where you sit. These cultures are sources of insights and local solutions. You've seen them on the film, right? And there's a tendency for us in academia, especially in the Western tradition, to think we have the answers and we want to transport these solutions to other different places. Let's not, repeat and reproduce, the colonial, imperial approach to science and, the diffusion of knowledge, and instead be, I guess, humbler and more reciprocal and more embracing of different perspectives. So I think this is my final slide. I think we have an opportunity here to build a new field of planetary mental health. If you Google it, there are some people already mentioning it. I think there's some initial ideas of what it might look like. We have our own discussions around the mental health COP, the social climate. So exciting times for our community, right? And didn't say even discipline, because this is a very transdisciplinary space. I'm not even a psychiatrist, but really excited about the nexus of the planet's health and the people's mental health. Emma's trained as a neuroscientist, right? And you're also here doing climate and mental health work. I think, we need to, frame it as mental health promotion on a planetary scale, because many of the influences or the drivers of our collective mental health are also global in nature. We cannot anymore just, focus on, a country or a particular population, because everyone's going to be affected, and, as they say in global health security, if there's lack of safety somewhere, there's lack of security everywhere. And I think it applies to mental health too, right? If one community has poor mental health, eventually it will translate to poor mental health on a planetary scale. We also need to start looking at how we can work more together with, for example, the climate justice movements, because we need a healthy planet. It's good for our mental health as well. We need this to be a truly global movement for all, because it's universal. It's not just for particular segments, as I've mentioned a while ago, and by all. For all, by all. And by all means we're garnering inputs from different places. And so I'm really thrilled by what we've started, right? Because we're really trying to bring new perspectives from different places. We need more. And then it's transdisciplinary and cross-sectoral as well. So, I guess this crowd, this room, is filled with people from different backgrounds. And I think our diversity is our core strength in, again, building this planetary mental health community. So, to conclude, we always say in the Philippines, because again, we've been experiencing these for decades, the Filipino spirit is waterproof, okay? Speaks about our resilience, our mental resilience, our community resilience, our national resilience. But this resilience is now being put to test because of the planetary health challenges that we're facing. And we need to come together and solve these problems, not just in a reactive mode, but really trying to prevent things from happening, addressing the root cause. We owe it not just to our own generation, but also to the future generation, and even to the young children who are yet to be born. I always close my talks by saying, it's time for us to think so that we will be seen by future generations as good ancestors. Because we've made the right decisions, not just for ourselves, but for their generation as well. We're not selfish ancestors. We're good ancestors. We're concerned about our mental health. We're concerned about their mental health as well. We protected our planet. and we created a better society and a better world. So, yeah, I think that's the end of my talk. Let's advance the mental health and emotional health of both people and the planet. Thank you very much. In 3 minutes.
Yeah, amazing. Thank you so much. Thank you so much, Renzo. Can we give him another round of applause?
Thank you. Thank you.
That was incredibly powerful, and even though I worked with you, and as you say, you're part of the Climate Cares family and a key, initial advisor. I think we've brought other people on as we've gone, but you were one of the sort of founding
original
advisors. So we've been the whole journey of Climate Cares with you, and couldn't have done it without you. So
thank you.
It's really wonderful to have you here. But even I, listening to that talk, had so many different thoughts in my head that you're sparking. So I'm sure everyone here from all the different backgrounds are also, you've got friends and colleagues in the audience. And, no matter where we're from, I'm sure everyone's taken a lot away from that. So thank you so much again.
Thank you.
Questions? I think we have some time. Bhutan.
Renzo, thank you. Inspirational talk.
Thank you.
2 quick questions. One is about the Philippines and one is more conceptually about mental health. In terms of the mental health, you talk about quality of life, and do you think it's time for a new instrument to measure quality of life and mental health and climate change? And what direction should that go in compared to current standards for quality of life questionnaires and things? And 2, in terms of islands, you talk about lots of different islands, but I have friends in Cebu, I have friends in Manila, etc. How does the differential in the different islands act together? Does the one change?
Right. Yep. Great questions. I guess a quick answer to your first question is yes. I think we need to look, much more deeply and broadly, right? Not just asking about, do you feel happy now? I think it's really about, quality of life overall. My kind of prediction is that, and this is unfortunate, right? Like whether in the pre-climate era, in the post or the during climate era, maybe quality of life have not really changed, especially for the poor, if not worsened, especially with all these stressors that I just mentioned, including, COVID and, the uncertain new regime that we are, starting in the country. And then when it comes to the geographic variation, that's actually one thing that, my collaborators and I have been talking about. Like, we were thinking maybe the, people who are living closer to nature, but also not in places where climate change is really kind of creating dramatic impacts, they might be happier, even if they're living much simpler lives than for us in the metropolis who have all these things that we want, but deeply living unhappy lives, right? Because, again, of, the stress and of modern life. So, these are initial ideas and certainly underexplored, geographic differences. Because when we do like cross-sectional studies, for example, especially now we've been doing it online. There are nuances that are missed out, right? So yeah. I hope I was able to answer. Salamat. Thank you.
Questions? Other questions? Jess?
Thanks so much, Renzo. It's so insightful and fantastic to see that kind of vision of where we should be getting to. And you mentioned things about building research agendas, but what do you see or what would you want to see as the kind of building blocks of next steps?
Yep.
And how do we get from where we are here to there?
Right. And we had some initial conversations, right? And we're somehow, already doing it. For sure, we need more resources to bring, let's say, a cohort of countries from different climate contexts, right? Working together, learning together, building both education and research capacity for climate and mental health, or even planetary mental health, if we want to kind of embrace that even broader vision. Because the thing with planetary mental health, it can cover other sources of mental health impacts like deforestation, right? Which we tend to not connect to climate change, or, in Australia, Grief Reef, right? The destruction of coral reefs, which is already happening as well in the Philippines. So, it will be interesting to also see how it's affecting, the social and life as well as the mental and emotional health of people living in those kinds of environments. So I think we're headed there, right? I think we're putting in place the right foundation. I'm already part of the community. We need more Renzos from different parts of the world. Hopefully the mental health COP that we're discussing can be a good, platform as well. So yeah, those are some initial thoughts. Cohort of countries.
Windsor, where does the action need to take place? Is it very locally? I'm struck in the film, people looking more to local government than national government.
Right.
I guess there's also the international collaboration. Where is it?
Right.
Where should we focus our efforts?
Yeah, and the quick answer is at all levels, action needs to happen, right? But then, as you've noted in the film, the people at the local level seem to be already resigned, right? Oh, nothing's going to happen at the national. When people are affected, they don't go to the president, they go to the mayor, right? And so we really need to build our local resilience. But we know that there are also limits to what they can do at the local level. The crisis is global. And the mitigation efforts certainly needs to happen on a global scale and accelerated pace. But I guess in terms of adaptation, that's where a lot of the local and subnational and national level, at the very most, that's where things can actually happen. And if we're going to just focus on mental health and climate change, sure, WHO can pass a resolution, as they always do, on climate and mental health, a resolution that usually does not have teeth. But if we work with national or even local governments, I think we can actually, it's going to be slow, but we will be seeing a lot of concrete impacts, maybe even immediately at the local, but slow in terms of scaling up, right? So, for example, and it's in connection to your question, if we identify 10 local governments around the world that are committed to both acting on the climate and building their mental health systems, we might be able to have a concrete project running in the next 3 to 5 years.
That would be amazing.
Yep.
I've got questions as well. I'm sure I'm going to get to pick your brains afterwards as well. So
Yep.
Are there any more from the audience? Spoiler, I can jump in with mine. Sorry, I'm not showing your name. Mikhail.
From my experience, corruption is still quite a big issue in the Philippines.
Yep.
How do you think planetary health organizations are going to work around the government that's still very pro
Right.
environmental
Right.
They're going to work away from that?
Excellent question. We know that's another big C that is affecting our world. We talk about COVID, climate, conflict, of course, especially with what's happening in Ukraine. But there's another C, which is corruption. Perhaps the C that connects them all, right? Because it's the corruption of our governments and of the industry that lead to all these other C's. Well, I think we need to just, speak up, right? And investigate this more and make sure that in, for example, climate and mental health work, we also call for good governance, right? Because there can be no climate resilience and mental resilience if governance at all levels, but particularly at national to local, are bad and corrupt. I can't think of specific actions right now, but perhaps that's our assignment. Work with anti-corruption colleagues, right? And those who are working for good governance. And there might be, exciting ideas that might come up. So yeah.
Yeah, I think interestingly the IPCC reports also speak about
Corruption.
the need for good governance,
Good
but
governance.
also how, and Jess has been looking into this, so you can probably speak to it more as well, but that societies with better, trustworthy governance and participatory approaches are actually, better for people's mental health and well-being, as well as you said, but also
And
emits less,
and translates to more investments in social services, etc. So yeah, so it seems everything is connected at the end of the day.
Exactly.
It's just the issues are connected, the movements are not, right? We still have our own climate and mental health silo. We try to bring two communities together, but we're still separate from, the bigger movement. And everyone complains about the siloing. Very few people actually work towards bridging, building bridges.
Thank you very much for your talk.
Thank you.
It's excellent. I wanted to ask from the perspective of data governance and information management, and how the Philippines is tackling using things like artificial intelligence for data gathering for planetary
Yeah.
mental health statistics.
Right.
I just wanted to ask.
Great question. AI is still very nascent in a country like the Philippines. But when it comes to data in general, I guess I would say, our data infrastructure is still at its toddler stage. Only recently we put up our privacy, policies, but also policies related to right to information, freedom of information. It's only within the past decade. But now, information is also being weaponized, including by government, right? To, promote, not just misinformation, but even to revise history. So these are some of the challenges that we're facing outside of the climate planetary health realm. Although if you say that planetary health is everything, then it's part of the story, right? And I guess now you're making me think, okay, what's really the underlying cause of this? Is it bad governance? Is it, right? Because if it's about good governance, then maybe we should be investing our energies there. And hopefully the rest will follow. Sorry if I'm...
Follow on to that.
Correct.
The question that I had was things like, early warning systems to sort of prevent forecast, climate,
right.
Disasters and catastrophes. Those are the sort of things that I was wondering whether or not.
Yep. Well, thanks for clarifying. And that's the other side, right? So I think the same answer. I think it's still, a work in progress. But in terms of using climate data to inform decision making, it's still not, I guess, being done on a national scale. There are, seas of innovation or islands of innovation in an archipelago of, things not happening. I think policy-wise, there's already an aspiration to adopt such type of governance that is data, informed. But the infrastructure is still very, weak, immature. Also technical capacity. There are very few people who are, educated to actually support governments, right? Right now, we're starting a project working with just 3 municipalities on bridging climate and health together. But we have thousands of them, right? And so we need to multiply our flock.
Yeah, thank you so much.
Yep.
I might, just for the interest of time, finish up with one final question.
Sure.
I think we're slightly over time, but we finished a little bit late, so I think we're going to stay. But just to sort of follow on from that, and also Hutan's question before, so the way that we conceptualize and think about mental health is sort of being challenged in the context of all of these kind of changes on a global scale, and also from perspectives coming of what is mental health and well-being from different parts of the world. And that affects, I guess, how we measure it, what we're aiming for, how we respond. And I was curious, you spoke about the different narratives that the local communities you spoke to think about when they think about climate. And similarly, when I've spoken to your colleagues on, even AJ, they've said working with local communities in the Philippines, they might think about mental health in a very different way to we do, and there might be sort of stigma around mental health in the ways that has been here as well and still exists here as well, but that talking to people about how they're thinking and feeling and their well-being in the context of something like a cyclone is almost like a way in that is less medicalized and more approachable to people. So I was just curious, on that theme of what we're talking about, what we're measuring, and how we use sort of local narratives. Whether you have any perspectives on that?
Yeah. Wow. We need a separate session, right? On the psychology of the Filipino people, right? There's even a textbook on Filipino psychology which has been rewritten over time because our concept of our mental health and psychology is also evolving, with digitalization even. So you talk to young people, they're starting to be very comfortable talking about it, even on social media. But there's also seems to be a generational difference. The older generation tend to have the more stigmatized view and, and also a more illness-focused approach rather than looking at well-being and, being a more functional member of society. So I guess there are two kinds of views right now. But of course, that also does not take into account indigenous views, which is also another big chunk. When you talk to indigenous peoples, they look at their mental health as connected to the health of the surrounding environment, which is something that we in the urban spaces or urban environments do not espouse. So yeah, I guess the short answer is there are multiple narratives. You know what? It might be a very good study to actually see how do urban people see it. People living in the slums, people living in the coastlines, people living in, in forest ecosystems, indigenous communities, and see, wow, we actually need a mental health system that caters to everybody and not just a cookie cutter approach that discounts, these nuances.
Great. Well, lots of work to do, I understand.
Right. It's a new PhD dissertation topic.
Thank you very much, everyone, for coming, and thanks again to Renzo for coming all the way from the Philippines to be with us.
Thank you. Hope this will not be the last.
I'm just going to stop the recording. If maybe someone can help me stop the recording.
Thank you so much. Thank you. It's